Hello friends, I am Dr. Ashish Sabharwal, Urologist, Prostate Cancer Specialist and Robotic Surgeon from Apollo Hospital, New Delhi. Today I am presenting to you Mr. MV. He is a patient from Cameroon. And now Mr. MV is just 10 to 15 days after his robotic surgery from prostate cancer, and he is flying back to his country tomorrow. So we requested him to give an interview and tell his experience how the recovery was.
Thank you. I am Dr. MV from Cameroon. I'm a medical doctor myself. I met Dr. Ashish, who took care of me for robotic radical prostatectomy. And this was conducted the 22nd of August. And today, I'm feeling so well that I'm ready to go home.
Yes. So we will just go a bit more in detail about the recovery. What patients ask me is that how will I be immediately after surgery? So immediately after surgery, when did you start eating? When did you start walking? All those things, please tell.
Good. After surgery that very day, the next, I have no souvenir of something changing with my own life. I started with liquid, food, and then I quickly continued with normal food. Right from, I think from the second or third day, I could eat already.
Yeah.
And of course,
You were walking normally? There was no
yes,
problem?
I was working normally, and the whole process was painless, so to speak, because of course, they took care of the pain during surgery, and there was also some post-surgical treatment taken into account, my pain. So for me, it was an experience really unexpected, because we conduct surgeries, but when you go through yourself, you don't know that that thing is finally so easy. Yeah.
So you also had a catheter?
Yes, I had a catheter which was kept, indwelling catheter, for 13 days. And
how was the experience about the catheter? Was it painful?
No, it was not painful, although the sensation was quite unexpected, because it was as if I was having a sort of foreign body in my body. But it seems as if the body quickly got into account that I had it, so I could move throughout daily with that indwelling catheter to do my other things, because you cannot come this far in such a great country without having an opportunity to visit here and there. So for me, keeping it that long was not the issue for me.
Yeah, so since you were from outside, we took extra precautions and kept the catheter for a little bit longer.
Yes.
Normally we keep the catheter for 7 to 10 days.
Yeah.
But I thought that since you're here, you're waiting, let us keep it for 1 week extra.
Yeah, and I will just tell you, doctor, if you decided to take it away before the 14th day, I would have refused.
Okay.
Because I want you to give myself all the chances.
Yeah. So, right. And so basically after discharge from the hospital, you were walking, everything was fine. You had any problem in doing any work?
No particular problem. I stayed in the hospital for 3 days, and I was discharged, I think, on the third or fourth day after surgery, and I was quickly independent. I will just let people to know that I came alone. I came alone, I was alone, so, but I was not alone at the end because of the management which was conducted around me. I won't even talk about the day I was operated upon. There was someone who was sent to stay with me, and I was so independent that I didn't need someone after that surgery. And this was the amazing part of the surgical results. See?
Very nice. So after that, while you were in the hotel, you were comfortable walking around, going around everywhere, doing sightseeing, right?
Yeah. In my hotel, I was, as I said, independent, and I could go up and down, and I even went to town. Doing other things. A few days after my surgery, it was amazing, really.
Nice. So then the day came when the catheter was removed.
Then I came, and Dr. Ashish removed the catheter himself, and that very day there was some sort of slow leaking urine, but right from the second day, I could already keep some urine. I even told him that I could keep something like 10 cc's at the beginning. Today, I'm almost back to my rhythm before surgery. That is, I can go out. Just to give you an example, I visited the Gate of India, stayed out there for 2 hours, but I could keep the urine. And really, I think that it was something very good for me to choose robotic. We know what it is. I'm not a robotic surgeon, but we know the advantages brought by them. And I went through the great experience with Dr. Ashish. Let me tell you that So I'm really amazed until now, really, from the bottom of my heart.
Yeah, so see, the thing is that I always tell my patients that we take special precautions for urine control because we think that just removing the prostate is not the only thing. We have to take special precautions to improve the quality of life of the patient. And urine leakage is something which is not acceptable to anybody. Some people, they think that yeah, maybe urine leakage you will accept it, but still if they have a result with no urine leakage, that is what we always aim for. For that, it is not only robotic surgery. I say that it is not only the machine, it's also the man behind the machine. So the robot is the same in many hospitals, but how trained you are, how well you are doing the surgery, how frequently you are doing the surgery, what are the special techniques the doctor is using. Like when we do the surgery, I do hood technique in which we don't disturb the ligaments and the muscles around the prostate, and we just remove the prostate out. We don't cut any of the ligaments. We do nerve sparing in which the nerves for urine control and erections are spared. And also we put the amniotic wrap in which the amniotic membrane, human chorionic amniotic membrane is put over the nerves during surgery. That's a synthetic membrane, and that helps in quicker recovery of the urine control and the erections. So we used all those techniques on Dr. MV also. So he is himself telling that now it is 3 to 4 days after the catheter removal and he's very comfortable. He's moving around just like as if he did not have any surgery and just like pre-surgery state. So this is what the advantage. Normally I tell the patients that 3 to 6 months it takes for the urine control to come back, but for him in 3 to 4 days only the urine control is back. And since I've started using the hood technique, this has happened. Like frequently I'm seeing patients within the first week only they get their urine control back, and he's a live living example of that.
Yes, I can confirm. Really, I'm sitting in front of you talking about myself, and myself being a medical doctor, what I'm living now, I even wrote to him that it is almost close to the way I used to control my urine before I was sexually upon. Yeah, I confirm.
So then finally his biopsy report also came. Now this is very important because when he came, the whole story is that he has a very strong history of prostate cancer. His father and many relatives had prostate cancer. His PSA was rising. 2 years back he did a PSA which was 6, then he ignored it, and then did a recent PSA which was 18. So such a rapid rise, and we did the surgery and the biopsy report showed that he has a Gleason 7 cancer, 3 + 4 7, and also at one part it is going outside the prostate. So people who think that prostate cancer is slow growing and we can ignore it, he waited for 2 years, and within 2 years the PSA rose to 18 and cancer started to go out of the prostate. So will you tell something about this thing?
Yeah, I really want to say something, and I say a lot because we discussed before I came concerning what was the management. We go through the whole checklist, so to speak, biopsy, going up and down. No, I was so happy to find that you took into account my medical history. And of course, everything was confirmed by the biopsy. And I remember yesterday when you gave me the result, we looked at each other when you say it is cancer, and we were all happy that knowing that it ought to be cancer. So what I want to emphasize here is that really it was so fast, the management, because the next day I came, I was planned to be operated, I think, after 24 hours.
Yeah.
And things went that way. And above all, something I really want to, talk about here is that since I came alone, although I said that I was not alone because people were around me in the hospital, but there was a team. There was a WhatsApp group that really marked me a lot, where my wife, my children were involved, and they could sort of live, having the feedback and the update. This is what I'm bringing back, really, because I won't tell you, my wife is a nurse. So for her, it was so difficult to stay very far from me when I needed her a lot. But I had that family, and this is for me, even myself, I've never done it as a medical doctor. So really, thank you very much for all these facilities. And you can come alone, you can come with an attendant. Really, if perfection belongs to this world, I would say that I went through perfection. Thank you once again, Dr. Ashish. Yeah.
So the next question is that the patient asks that now what is the further course? Now the surgery is done, prostate is out, biopsy has come, now what? The next point is that you have to do a PSA. It is a cancer. You cannot forget that it can come back anytime. So you have to do a PSA test, and target PSA is less than 0.1. I have told Dr. MV also that if the PSA anytime rises, then he has to consult me and we will do some further tests and see what the cause is, and accordingly we will treat. But otherwise, every 3 months, 6 months, you should repeat a PSA. As long as the PSA is less than 0.1, nothing to worry.
Yeah, I've been told all this, and as a matter of fact, as we just said, I have a very strong family history. So I will abide by all those recommendations to be sure that I'm free of cancer, because everyone knows what is cancer. Life is good, everyone wants to live longer. So I will do my PSA regularly every 3 months, and as soon as something is done, he even told me that I can let him know, so that if, for example, there's hormonal therapy, we may still get some of the treatments from here.
Yeah, that we can do.
Yeah.
So since patients are coming from far off, they often ask me that after surgery, how frequently we have to come for follow-up, because just coming for surgery and going back, so it would be a hassle for them to come all the way again. So after successful robotic surgery and prostate cancer treatment, when the cancer is out, PSA 0, all the time we support by WhatsApp, and patients don't need to come. You have to just send your reports of PSA. If everything is fine, then you just have to follow with WhatsApp messages after 3 months. You don't have to come all the way to India every time, every 3 months, every 6 months. Even I have patients who have done surgery like 7 years back, 10 years back, and they've never come back after that, but they are in constant touch with me through email or WhatsApp. So thank you, Dr. MV. I treat many patients, but there are very few doctors who also are patients, because they're also human beings and they can develop prostate cancer just like anybody else. So whenever a doctor trusts me to do his surgery, I'm more and more obliged to him that he trusted me. And I'm very happy that everything is gone well. Your urine control is good, your prostate is out, your cancer is out. So hopefully in the coming years you will get your urine control 100% back, you will have your PSA 0, and you will have an erection back, and you'll lead a normal life.
Yeah, this is what I hope, and this is what I foresee coming really. Yeah. If I take into account the fact that the urine control is getting quite quick, because this was my main worry. I was ready to go for 3 months. This is what I read in the books. I'm not a urologist, but the fact that it is coming that fast also tells me that all the other things are going to be done really accordingly. I really want to say a very deep thank you from the bottom of my heart. You are my savior, Dr. Ashish.
Thank you.
Really, I have kids, they were still expecting many things from me. I think you are the one who finally allowed me to keep on. Thank you.
So friends, I hope you understood his experience and understood that robotic surgery is safe and recovery is quite quick. You don't have to be scared about urine leakage and all that, because the way we do the surgery, the urine control comes back quickly, you don't have to worry, and you will be cancer free. If you're also suffering from prostate cancer and you want to consult me, then you can email me or WhatsApp me. My email address and WhatsApp number are given in the description. Thank you.